8 minutes to 8. We'll welcome Peter Barron to the show in the next few minutes for today's headline challenge. First, though, placing a loved one into care. It isn't an easy decision, isn't it? But knowing that they're going to be looked after does offer you a bit of peace of mind. Well, a Yarm-based company which aims to offer that reassurance for residents and their families has been asked to carry out a surveillance pilot project over in Australia.
Sounds incredible, doesn't it? Care Protect were approached by the federal government down under following a major scandal. This was at a care home where elderly dementia patients were abused and over-medicated. Ben Wilson is from Care Protect's UK branch and he joins us this morning. Morning, Ben.
Morning. How are you?
Yeah, really good, thank you. This is good news in some ways, of course, because it's that thing you clearly need to highlight any issues for families and for fellow workers. Just explain how these cameras work.
Okay, absolutely. Well, firstly, the cameras in private areas operate very differently to cameras, say, in communal areas, for example. So private cameras, such as those in bedrooms, are only activated maybe when a certain stimulus occurs. So it may be a change in ambient movement, light or noise. So they're very selective in what they actually record.
So if for example, if a care worker is coming into a bedroom, it would activate then, would it?
Absolutely. So it might not record a resident sleeping in bed, so it's promoting privacy from that point of view. But if there are any suspicions, maybe around poor practice, the camera will only be activated when a carer comes into the room or perhaps goes near the bedside, or indeed another resident comes into the room.
Yeah. So what kind of behaviour can these cameras prevent then, in your experience, Ben?
We were set up post-Winterbourne View scandal, really. So what we were looking at was abuse, but as a byproduct then we've picked up a number of things around poor practice, particularly manual handling errors. A lot of the time abuse, in inverted commas, isn't malicious, but it's just an oversight at times and complacency. So not necessarily a member of staff actively going out to do something wrong, but these things are being picked up as well. So it has, we've seen a lot of reductions in hospital admissions from our own care homes, for example, because of unwitnessed falls that are now witnessed. So we can do a very quick injury assessment.
You've mentioned there about doing this pilot project in Australia. Do you know how they found your products to be? Were they massively in support of them?
Well, we identified a need in Australia, again, following an Oakden abuse scandal, which was an elderly mental health facility in South Australia. And we approached the government and we worked alongside them, providing information and guidance through a royal commission that was set up to investigate these findings. And what we've actually established now is a working relationship and a pilot in 5 state-run care homes to look at practice and to improve quality standards and also assist the government with maintaining those quality standards. So it's a very exciting time for us, actually.
Could we see this introduced here in the UK, do you think?
Well, we've been operational in the UK now for 5 years, and we have a large number of care home clients as well as mental health facilities, particularly those for children and adolescents. We have around 4,000 cameras installed now across a number of facilities.
We just need it. We need more, don't we? I think this sounds like an amazing project. It sounds brilliant.
Well, that's the thing. I mean, it's installed and actually live monitored or retrospectively monitored by a team of trained nurses and social workers who are all registered with the Security Industry Authority to provide us with that extra level of training and clearance to view sensitive data. So there is a large need for it, but very often providers are afraid of camera technology because they often see it as a big brother or a spying exercise, but it couldn't really be further from that.
It's just protection, isn't it? Ben, thank you so much for coming on the show and chatting to us this morning. That is Ben Wilson. He's from Care Protect UK, doing this pilot scheme over in Australia and bringing peace of mind to people who are placing loved ones into care homes.
The headline.